Hello everyone, we are Group 4 and today we are going to talk about deep brain stimulation, also known as DBS, specifically for depression. My name is Jocelyn. I'm going to go ahead and just present on the general information of what deep brain stimulation is. Before I dive deep into what it is, I'm going to present some background information and history on DBS. So deep brain stimulation was first developed in 1987 in Grenoble, France. It was originally created to treat chronic pain and tremors. Later on, we will talk about what other mental health conditions besides depression that DBS is used for. We'll also be going over the cost of the procedures as well. I believe a rough estimate of what it is, it's around $30,000 to $70,000. What is DBS? Deep brain stimulation is a surgical procedure where electrodes are implanted into the brain. The electrodes can then generate electrical impulses that control quote-unquote abnormal brain activity. In the case of depression, it can adjust any chemical imbalances in the brain. Some advantages of this procedure are that the effects of DBS are reversible. So if a patient decides to no longer undergo deep brain stimulation, they can receive surgery to take out the electrodes and the internal pulse generator, which you can see under the upper right picture right here under this patient's left clavicle. Additionally, a patient with DBS can also participate in stem cell or gene therapy later on in the future, and this does not cause any harm to the patient according to research. So this here is a diagram of what deep brain stimulation looks like. Starting at the top, we have the probes, and they deliver electrical impulses to a specific part of the brain. These here are the electrodes at the very top. They are insulated wires inserted through a small opening of the skull. The extension wires are not labeled on this diagram, but they run down this patient's neck, and it connects the electrodes to the internal pulse generator. The internal pulse generator is what you see that's under the clavicle. It's also known as the IPG, and it is a lithium battery that generates electrical impulses. So I will go ahead and pass this on to the next person.
Hi, this is Victoria. I'm going to present what patient population DBS serves. DBS serves a wide range of patient population. Age usually isn't an issue, but it is recommended to be strong enough to withstand the major surgery. The first population is pediatric. Based on the 24 reports, the data is found that there is a spectrum of clinical evidence for the use of DBS and to treat different disorder. While currently dystonia is the most promising application of DBS in the pediatric population, multiple conditions currently being investigated in adults also afflict children and thus deserve further research. For adults and elderly, as mentioned before, DBS should be under age of 70 years because they must be strong enough to go through with the surgery. Their doctors will complete an evaluation to see if they are a candidate for the DBS, which usually is done with MRI, physical and neurological testing, and to prepare for the procedure. Also for women in pregnancy, data is shown that it is safe for women with movement disorder, tourniquet syndrome, and OCDs who have a DBS system implanted to become pregnant and to give birth to the baby. It does not affect fetal development, and it does improve symptoms and reduce medical treatment, and which decrease the dosage of medicine.
Hello, my name is Paula. I'm going to be presenting the health conditions DBS is used for and the main areas of the brain that DBS focuses on. So first one for depression, of course, which we're going to be talking more about in a few slides. For obsessive compulsive disorder, actually the idea for treatment of depression with DBS in certain regions of the brain came from reports of stimulations of OCD patients where their symptoms, their depression and anxiety simultaneously improve. Also in primary dystonia, Parkinson's disease as well. Parkinson's disease has been the main target in which DBS was first used for, with positive results as well. Essential tremors, Tourette syndrome. Many studies have been done on Tourette syndrome as well, and the results on the patients was very positive as well. Anorexia, there's only been like 2 studies done in anorexia, with the population being adolescents. So this is still like an ongoing process in which they want to expand the patient population to older adults. It also works with PTSD and addiction and substance use disorder. So they're still working on this disorder as well, addiction. Not too many studies have been done on that, but the results are very positive. So DBS for depression, so it acts on the subcallosal cingulate cortex. Increased activity has been linked with depression in this area of the brain, and the first trial was done in 2005. Since then, multiple trials have shown similar therapeutic response, a few related adverse effects, and it also works on the nucleus accumbens. This is a group of neurons that have been closely linked to motivation and reward-seeking behavior. For example, like monetary reward, use of substances, and for example, viewing attractive faces as well. So medial forebrain bundle. So this is a white matter tract that mediates connectivity between many important cortical and subcortical regions of the brain. For example, dopamine and serotonin hormones are released in this part of the brain, which we know these are like the pleasure hormones, like the good feeling hormones. So there is a decreased activity in this region of the brain. That's why DBS acts on it. Also in the lateral habenula and inferior thalamic peduncle. So several smaller studies have demonstrated antidepressive effects of DBS in this area. And the ITP has been implicated in learning, arousal, attention, and also in depression. And hyperactivity of this region is seen in patients with depression. So the ITP is a discrete fiber bundle connecting the non-specific thalamic nuclei to the orbitofrontal cortex. So now I'm going to transition to the next person.
So my name is Eric. I'm going to talk about the benefits of deep brain stimulation on depression. Originally, this treatment was designed to treat Parkinson's disease, essential tremors, and movement disorders like Paula mentioned about. But the study found out that it also has some major progress on MDD treatment after a few years of long-term follow-up study. Helen Mayberg and her colleagues at the University of Toronto had a study on whether if DBS is an effective treatment option for depression patients or not. Among the patients of the study, participants of the study, 1/3 of the patients were treatment resistant to psychotherapy, antidepressant medication, and other brain stimulation. Electrodes were placed in the part of the brain area called Area 25, and the follow-up period ranged from 4 to 8 years. Not a single participant committed suicide during the time frame, and most of the participants experienced an antidepressant response on Area 25. Also, based on the overall symptom severity and increased function of the brain, the treatment worked better on the patient with regular depression than the patient with treatment-resistant depression. On top of that, further research was needed to define the effectiveness of DBS in depression due to small sample size. Moving on to the next slide, the reason why deep brain stimulation is beneficial to us. First, it can reduce the adverse symptoms such as motor symptoms like dyskinesia, stiffness, or slowness. It has also shown that it can improve the mood and quality of life and an individual's energy level. Also, you don't have to remove the nerve cells. Although this treatment requires a surgical process, it's just attaching the mood pacemaker to your brain. By doing the deep brain stimulation, you are less likely to use the medication, which will eventually minimize the side effects of the drug. Finally, the intensity and the frequency of the stimulation can be controlled by the patient themselves or by the physicians, so it helps the patient with their daily activities and gives them more control on their emotions and movements. Since there are many variables in this treatment, this might not be successful for everyone, but it will lessen the patient's symptoms, and when it works, it can improve the symptoms significantly. But I think it's important to talk with the doctor before the surgery about the expected outcome. Next, Renee will be explaining about the adverse effects of the treatment.
Okay, thank you. My name is Renee. I'm going to be presenting the adverse and side effects of DBS. So after the implantation of the DBS system, the following side effects may occur after stimulation: temporary tingling in the face or extremities, feeling of pulling in the muscles, feature vision issues and loss of balance. So because DBS is an invasive neurosurgical operation, the following risks and adverse outcomes may occur. As with any surgery, there is an increased risk for infection, hemorrhage, perioperative headaches, and seizures. There's also a chance of an air embolism that can travel and lead to respiratory failure, heart attack, altered mental status, or stroke. The CSF, or the cerebrospinal fluid, or brain fluid leakage may also occur, which increase the risk for meningitis, brain abscess, intracranial hemorrhage, and neurological defects. So right here, at the top, these are the normal radiographs of the DBS system. So right here shows the anterior view of the electrode and the lead implant. Right here shows the sagittal view. And right here shows us a part of the extension cable and the neurostimulator or the pulse generator. At the bottom, from left to right, the first one shows us the lead fracture located at the cervical region. Right here is the lead fracture at the mastoid region or behind the ear. This one is right at the chest area. And the last one just shows us an incomplete lead fracture. And right here, it zooms into the distortion of the leads. So we can see it right there. So because of the use of small devices, such as I've mentioned, the leads, there is a potential for breakage, which can alter the electric current being delivered and also the amount of voltage. So if suspected, it is very important to verify the electrode impedance, assess the side effects of the voltage, and conduct a radiological evaluation.
Hi everyone, my name is Shasta and I will be telling you about whether or not this treatment is covered by insurance. First, I will point out that DBS treatment is currently FDA approved, but only to treat Parkinson's disease, epilepsy, and obsessive compulsive disorder. Unfortunately, DBS treatment is not yet approved by the FDA to treat depression. Technically, this type of treatment for depression is still in its clinical trials and is currently being evaluated for use in psychiatric disorders. However, it would be used as a last resort, meaning after what would be categorized as failed treatments of depression with medication, psychotherapy, as well as ECT. Due to the lack of approval, insurance companies do not provide coverage. Now, with that being said, deep brain stimulation costs at minimum $30,000 plus physician and MRI fees. To provide a little deeper understanding, even the FDA-approved conditions that are able to receive this treatment and are technically covered by most health insurance companies still have struggles with receiving approval. Some insurance companies will still require prior authorization before having surgery and may even initially deny coverage. This denial may be based on the false assumption that DBS is experimental. Now, DBS surgery for a diagnosis of depression, even if diagnosis severe, is technically considered experimental and will be denied coverage. This treatment for depression is not seen as medically necessary, and at this time it is only investigational, meaning there have not been enough studies to show that DBS for depression will actually help the issues at hand and is unproven in terms of efficacy. These insurance companies, along with the FDA, do not fully understand DBS and how it has potential to be extremely beneficial for individuals suffering from severe depression. What is needed is more clinical trials, research, and evidence to prove how successful this treatment can be, especially for treatment-resistant depression. Now let's move to the next slide.
What is the future outlook for deep brain stimulation, and does it have a future with treatment of depression? Each of us will be sharing our perspective about this. I'm going to go ahead and start. I wanted to reiterate that DBS is used as a last resort for depression treatment, particularly the treatment-resistant depression. DBS studies are difficult to conduct since they involve a pricey and intrusive surgery. However, new technology, including use of high-resolution electrodes, compacted smaller IPGs, and more efficient rechargeable batteries, has opened the road for competition and the development of innovative DBS technologies.
Just from like what my classmates have been saying, it appears that DBS has had a lot of positive results, which is good. The only negatives, of course, are the fact that it's not widely available, especially since it's not technically approved to treat depression, and also that it's super expensive. So I'm hoping that in the future, DBS could be more widely available and also more cost-effective as well.
And just like everybody said, I agree that DBS can be harmful, and in a way that it's used as the last resort. But I still think that DBS treatment, it's still going through a process, which we know that it takes a long time for it to show the positive and negative results of it. But I think so far there have been more positive impact on the patients. So the complications that can arise with DBS can be reversible in comparison with other forms of treatment, like, for example, medications. So for me, I think DBS is a promising treatment for depression and many other mental health disorders.
As mentioned before, DBS has a potential for many illnesses. I think that DBS is a relatively well-tolerated therapy because it is an invasive procedure. It carries risk like all surgery does. DBS requires an implantation of electrodes in the brain in specific regions. It has no brain tissue is removed or anything like that, so it can be reversible if it does not work out.
And as all of my fellow group members stated, I also believe this is a great treatment option. If research will continue and provide better understanding of DBS for treatment of depression, more and more evidence can show how effective this treatment actually is. In addition, once FDA approval is reached by having that evidence, insurance companies will begin to hopefully provide coverage for DBS treatment of depression, and this could provide a potential life-changing treatment for individuals suffering from depression.
For me, I think Ever mentioned, like every treatment has their own side effects, and like there are some risk, but like this treatment, based on my research, it was really there were a lot of good pro side than the con side. So I think they should do more research on this, and it will change the depression treatments.
So the question that we have for you guys is, in your opinion, what are some advantages and disadvantages for this treatment? Do the potential benefits outweigh the risks? So I'm just gonna go ahead and wait there. Feel free to take a picture of it or burn it into your brain so you remember it. You can always go back and look at it as well. But yeah, that's our question for you guys. I'm gonna go ahead and transition to the next slide. So here are some reliable, credible sources about more information about DBS. Some of us got information from the National Library of Medicine, American Association of Neurological Surgeons, as well as the Journal of Neurosurgery. So if you or someone that you know who might be interested in DBS, feel free to check these out. There's a lot of credible journals on all these sites, and they're all really interesting. And of course, you can always look it up online and so forth. So that was our presentation. This is our excited page. We just want to thank you to everyone for listening. And yeah, that was group 4. Thank you guys so much.